What is high blood pressure? High blood pressure is a common condition in which the long-term force of the blood against your artery walls is high enough that it may eventually cause health problems, such as heart disease. Blood pressure is determined both by the amount of blood your heart pumps and the amount of resistance to blood flow in your arteries. The more blood your heart pumps and the narrower your arteries, the higher your blood pressure. You can have high blood pressure, hypertension, for years without any symptoms. Even without symptoms, damage to blood vessels and your heart continues and can be detected. Uncontrolled high blood pressure increases your risk of serious health problems, including heart attack and stroke. High blood pressure generally develops over many years, and it affects nearly everyone eventually. Fortunately, high blood pressure can be easily detected, and once you know you have high blood pressure, you can work with your doctor to control it. Symptoms: most people with high blood pressure have no signs or symptoms, even if blood pressure readings reach dangerously high levels. A few people with high blood pressure may have headaches, shortness of breath or nosebleeds, but these signs and symptoms aren't specific and usually don't occur until high blood pressure has reached a severe or life-threatening stage. Causes: there are two types of high blood pressure. Primary, essential, hypertension. For most adults, there's no identifiable cause of high blood pressure. This type of high blood pressure, called primary essential hypertension, tends to develop gradually over many years. Secondary hypertension: some people have high blood pressure caused by an underlying condition. This type of high blood pressure, called secondary hypertension, tends to appear suddenly and cause higher blood pressure than does primary hypertension. Various conditions and medications can lead to secondary hypertension, including obstructive sleep apnea, kidney problems, adrenal gland tumors, thyroid problems, certain defects in blood vessels you're born with, congenital, certain medications, such as birth control pills, cold remedies, decongestants, over-the-counter pain relievers, and some prescription drugs, illegal drugs, such as cocaine and amphetamines, alcohol abuse or chronic alcohol use. Tests and diagnosis: to measure your blood pressure, your doctor or specialist will usually place an inflatable arm cuff around your arm and measure your blood pressure using a pressure measuring gauge. A blood pressure reading, given in millimeters of mercury (mmHg), has two numbers. The first, or upper, number measures the pressure in your arteries when your heart beats, systolic pressure. The second, or lower, number measures the pressure in your arteries between beats, diastolic pressure. Blood pressure measurements fall into four general categories. Normal blood pressure. Your blood pressure is normal if it's below 120/80ths of a millimeter Hg. Prehypertension. Prehypertension is a systolic pressure ranging from 120 to 139 millimeters Hg or a diastolic pressure ranging from 80 to 89 millimeters Hg. Prehypertension tends to get worse over time. Stage 1 hypertension. Stage 1 hypertension is a systolic pressure ranging from 140 to 159 millimeters Hg or a diastolic pressure ranging from 90 to 99 millimeters Hg. Stage 2 hypertension. More severe hypertension. Stage 2 hypertension is a systolic pressure of 160 millimeters Hg or higher or a diastolic pressure of 100 millimeters Hg or higher. Both numbers in a blood pressure reading are important. But after age 60, the systolic reading is even more significant. Isolated systolic hypertension is a condition in which the diastolic pressure is normal, less than 90 millimeters Hg, but systolic pressure is high, greater than 140 millimeters Hg. This is a common type of high blood pressure among people older than 60. Your doctor will likely take 2 to 3 blood pressure readings each at 3 or more separate appointments before diagnosing you with high blood pressure. This is because blood pressure normally varies throughout the day, and sometimes specifically during visits to the doctor, a condition called white coat hypertension. Your blood pressure generally should be measured in both arms to determine if there is a difference. Your doctor may ask you to record your blood pressure at home and at work to provide additional information. Your doctor may suggest a 24-hour blood pressure monitoring test called ambulatory blood pressure monitoring. The device used for this test measures your blood pressure at regular intervals over a 24-hour period and provides a more accurate picture of blood pressure changes over an average day and night. However, these devices aren't available in all medical centers, and they're rarely reimbursed. If you have any type of high blood pressure, your doctor will review your medical history and conduct a physical examination. Your doctor may also recommend routine tests, such as a urine test, urinalysis, blood tests, a cholesterol test and an electrocardiogram, a test that measures your heart's electrical activity. Your doctor may also recommend additional tests, such as an echocardiogram, to check for more signs of heart disease. Taking your blood pressure at home. An important way to check if your blood pressure treatment is working, or to diagnose worsening high blood pressure, is to monitor your blood pressure at home. Home blood pressure monitors are widely available and inexpensive, and you don't need a prescription to buy one. Talk to your doctor about how to get started. Lifestyle changes to treat high blood pressure. No matter what medications your doctor prescribes to treat your high blood pressure, you'll need to make lifestyle changes to lower your blood pressure. Your doctor may recommend several lifestyle changes, including eating a healthier diet with less salt, the dietary approaches to stop hypertension, or diet, exercising regularly, quitting smoking, limiting the amount of alcohol you drink, maintaining a healthy weight or losing weight if you're overweight or obese.